The governor also announcing the state will send 2,500 nurses from outside of Texas to short-staffed hospitals across the Lone Star State.
But the KVUE defenders discovered his action comes weeks after state leaders rejected requests from hospitals, including some in Austin, to urgently send more staff. Senior reporter Tony Plahetsky found it's largely been a battle over who will pay their salaries, even as the outbreak overwhelmed hospitals.
At the worst of the COVID-19 pandemic, Texas officials dispatched more than 14,000 nurses across the state, and hundreds came to the Austin area. In May, the KVUE defenders showed how the state spent more than $4 billion on emergency medical staffing without seeking competitive bids. But in July, when a summer surge started infecting thousands, the state rejected requests for that same help. This letter from the chief of the Texas Division of Emergency Management explains that state officials wanted local leaders to instead use federal coronavirus local fiscal recovery funds, billions of which went directly to counties and cities across the state.
We have testing materials, we have vaccine, and we have money.
Chief Nim Kidd reiterated that position Tuesday at a meeting with the Senate Committee on Health and Human Services, adding that the state had previously spent nearly $10 billion in staffing nurses in the past year. He said part of the problem is that local governments haven't tapped into the available federal money to hire its own nurses.
This is frustrating for a lot of us that are trying to help and trying to provide services and resources.
But finding nurses has been easier said than done, healthcare officials told the KVUE defenders. That's why State Senator Sarah Eckhart of Austin says she began lobbying the state to restore what it had been doing when local officials recently asked for her help.
I've seen the state really dismantle what it built reluctantly during the first two surges, rather than improve upon the model so that we would be better prepared for this next one.
Austin public health officials say a lack of staffing has kept them from reopening the Austin Convention Center as a makeshift hospital, as they had done months ago. At the February height of the pandemic, a large area that includes Austin, Waco, and Bryan College Station had up to 800 state-supplied nurses. The Texas Department of State Health Services said that that same area asked in July for slightly less and was told no.
I can't think of one region that we haven't had a call or a request for nurses from.
Kidd said in that same meeting Tuesday that he had just received orders from Governor Greg Abbott to again put a similar nurse supply program back in place. Weeks, though, after the start of the summer surge that has now inundated hospitals.
The governor made it very clear to me yesterday the intent is to go out there and help support the healthcare system and get it shored back up.
And by Wednesday, Abbott issued this news release saying he will deploy 2,500 nurses, mostly from outside the state. In a news release, the Texas Department of State Health Services says cities like Austin that have recently had their requests for nurses rejected should reapply. But it added that hospitals should be judicious. As to who will pay, well, Governor Abbott says he has committed to doing so through the end of next month, but officials say extended deployments may require local governments and individual facilities split those costs. Brian?
KVUE's Tony Plahetsky live in the newsroom. Thanks, Tony. Now, we do want to mention this, too. Our big three hospital networks in Austin released a statement to the KVUE defenders saying that they are doing what they can to find and keep nurses and welcome any additional help that the state of Texas can give.